Assalamu alaikum, my name is Dr.Faisal Mahmood. I was recently asked by Dawn to answer some of the common questions that people are asking about the coronavirus, and I thought we could go over this one by one. The answer is we don't know. We hope it will. It will probably slow down a little bit, but it's unlikely it's going to completely stop the spread with the warming weather. Well, no, the flu shot only helps against the influenza virus, but it's always a good idea to get yourself vaccinated because influenza can also cause a severe disease and cause death in some people. So you're not more likely to contract the infection, but yes, if you do get the infection, you are more likely to get a more severe disease after that. No, pregnant women are considered to be more at risk of this infection, and currently we have no data to tell us if pregnancy and this virus have a negative interaction. That's a really good question, and the answer is no. In fact, some people may have no symptoms, some people have more than one symptoms, and they may not all appear at the same time. A brilliant question, because that's exactly what us health experts say, that wearing a face mask has no benefit. Actually, you're absolutely right. If you are wearing a face mask and you're putting it down and up, you're probably contaminating your face more, and that's even more dangerous than not wearing a face mask. So please, no need to wear a face mask if you're out in public. That is exactly what is happening, that healthy and people who may have a low immunity will eventually hopefully recover, and that's why we say that 80 to 90% of people need no treatment, because the body is strong enough to take care of this virus in almost all cases. You know, ideally, if you're not feeling well, you should contact your healthcare provider, ideally over the phone as opposed to going to the clinic and asking them. Generally, as of now, the rule of thumb is if you have traveled and you're not feeling well, if you have met somebody who's traveled and now you're not feeling well, if you feel you've met somebody who has this infection and now you're not feeling well, then you should contact your healthcare provider, who will decide if you need to be screened or not. The best way to disinfect your home is to use soap and water. You can use a dilute bleach solution, and really you should disinfect those areas where people will be touching their hands a lot. So that would be like your dining table, your chairs, your bathroom, of course, and usually once a day should be sufficient. The treatment or cure for any disease is not really a medicine specifically for it. Sometimes the treatment means that we will treat the symptoms and let the body take care of the virus itself, and that's exactly what we do in this case. There are some medicines people are working on, and there is just not enough data at this point. Data is coming, so at this point we are not recommending any particular medicine to treat this infection. Again, most people will be able to take care of this all by themselves.